Hey, it's Dr. Jejurikar again. Thanks for tuning in today. Today I want to talk about breast implant profiles. It's something that patients know exists and a lot of times will ask me questions about, but they don't really know what it is. A simple way to think about it is that a breast implant profile refers to how far an implant sticks out from a patient's chest. So a higher profile implant or a high profile implant is going to stick out further than a moderate or a low profile implant. The question is, why do these distinctions exist? Well, for patients that want to have a lot of upper pole fullness and actually like that augmented round look, a higher profile implant is going to work. It's basically taking the same amount of volume and it's condensing it down to make the implant narrower, thus the implant sticks out a little bit further. For patients that want a more natural profile, or a more natural look, they're going to want to have something that's a more mid-range or moderate or even a lower profile implant. Sometimes it's confusing to me though, because patients will come in and they'll say they want a natural look, and then they'll pick implants or have the notion that they want to have a high profile implant. So the way that we generally approach it with patients is, let's figure out how big you want to be. We'll try to pick a general range off of that, and once we figure that out, we then figure out what kind of look you're going for. Are you going for a more natural look or a more augmented look? Once that happens, we can select your profile. I know it's all a little bit confusing, but if you just remember that a high profile implant looks round and it sticks out further, you're going to be a leg up on most patients out there. Thanks so much for paying attention.